Later on, you do get other professionals as well who were published in England, although the one that's coming to mind was actually a Scottish physician, Dr. Cheney, who wrote a treatise on long life. The full name is escaping me, but it was, again, a book concerning diet, because he had gotten up to 400 pounds or something and had moved down south to Bath and had completely changed his lifestyle and had lost all the weight and wrote a book about it. So that also gets pretty popular north of the border as well. Apparently the medicinal benefits of the bath waters in Bath were beneficial.
So did Dr. Cheney essentially write one of the first weight loss books?
In a way, he did. And it is also particularly interesting because as a vegetarian, he was one of the first to actually advocate a vegetarian diet. It is very interesting, but he doesn't get popular so much as a diet book. I think the first really popular fad diet doesn't come around until William Banting in the 1800s. But yeah, I guess you could argue that his is the first weight loss book, yes.
You mentioned all of the bubble, toil and trouble recipes. I don't suppose you have an example of one.
If you look at the pharmacopoeias of the Royal College of Physicians in Edinburgh, you do get the sense that even professionals used things that we would now maybe not consider appropriate. And they were completely sanctioned by professional physicians, Royal College of Physicians in Edinburgh. The thing that comes to mind in particular is skulls were used quite often, but there is a recipe that uses a male skull for convulsion fits. For a male, take the skull of a female, beat it into powder, and take thereof 2, 3, or 4 grains according to the age of the patient, infused in ale or any other liquor he can drink. Let him drink thereof for several mornings together. For a female, the skull of a male. So there's an example of a recipe. But there's also, toads were a thing that, boil, toil and trouble kind of thing as well. But toads were actually used in medicine. And another really popular recipe ingredient was snails, which people, I assume, could just go out. That they do say that it has to be a garden snail. So they just go outside and pick a few snails and come back and use it in their medicine. So there are definitely ingredients within recipes and professional medicinal recipes that we would today maybe find a bit unsavory. At this point, at least the recipes that I'm looking at, you don't get so much of the things like laudanum, which were popular in the 1800s and things. I think the only popular conception of a bad medicinal ingredient is there's a recipe that I found that has mercury in it, but you don't get so many of the really popular unsavory. Although now, come to think of it, there are a couple of recipes with lead in it. So, but yeah, it's really interesting. You don't get that many with unsavory ingredients.
When people were designing these recipes, was there some prevailing logic behind this ingredient deals with this humour, or was it all trial and error?
There was some logic behind it. There definitely were ingredients that were considered cold that you would then give for somebody with a fever kind of thing. So there was prevailing logic. That being said, in particular in domestic medicine, where women are keeping recipe books and things like that, it was a lot of trial and error. You can see in recipe books, people have come back and crossed things out and said, actually, this isn't that great, use this instead. There was some logic, but I would say that, at least in a domestic setting, it was more trial and error. I think also it's really interesting when you look at when newspapers started to proliferate in Edinburgh as well, that you do get recipes within those newspapers. But there was one that I was looking at that was an Evening Current, who they had 3 different recipes for rabies. So you kind of have to assume that somebody's copying down the 3 recipes and going, actually, this one doesn't work. I don't know why we even tried that one,